the people who are going to be prioritized to receive the vaccines are healthcare workers who are on the front lines, as well as anybody who works in a hospital, and then those who live in skilled nursing facilities. Skilled nursing facilities account for about 6% of the population, but almost 40% of the deaths due to COVID. So these are very high-risk individuals for bad outcomes from COVID. It looks like it's the same kind of side effects that you would get from influenza or a tetanus shot. You get a sore arm for a day or two, maybe a headache or fatigue, and then that goes away. There's no way that you can get COVID from the coronavirus vaccines. There's absolutely no way. It's just a small fragment of the RNA that encodes for a small portion of the spike protein, so it doesn't replicate, it can't replicate, and it can't cause COVID. We're going to have to be masking and social distancing for the foreseeable future. When we'll be able to stop masking and social distancing is when we achieve some level of herd immunity within our communities. That's going to take 60 to 70% of the population to be immune. Right now, through infection, if people are immune after infection, which we're still not sure, there's been less than 10% of people in the U.S. who have been infected. And then when the vaccine comes out, it's going to come out in limited quantities. And so we're not going to be able to vaccinate everybody all at once. So we anticipate that we will be able to achieve that 60 to 70% immunity either through infection plus immunization, maybe the middle of 2021, maybe the end of 2021. We'll just have to see.
They're stored in the -70 freezer, and they will be taken out of there when it's appropriate. The hospital is just going through the final checks to be able to implement the vaccination program for our high priority groups, and we will roll out when it's appropriate.